want to convert every PHC and CHC into a wellness hub. And this is how I think is the way forward. Medical tourism is still not tapped in the state of Goa. So we want to have a think tank. The other day we had a discussion briefly with the CI also to help us what is the way forward and give us suggestions how we could actually capitalize over the next 2 years and frame a policy for medical tourism. Actually, we don't need a policy. We just need to move forward and implement this in a different way. I, for one, believe that public-private partnership is very important. It is to be integrated along with like primary and secondary care can be taken care of by the government, tertiary care, the private sector can come in. And this is how we need to have a model in which we can successfully create a very successful kind of integration. Volume is also required. If volume is not there, no private player is going to come forward to tie up with any institution. However much you publicize it, best consultancy agency you take on board, that's not going to work. So as a result of which we need to take people, and why I talked about Manipal is that Manipal has not only been providing good quality healthcare, but they've also been investing in disruptive technology in multiple ways, and this is one of those which we are also utilizing.
To my mind, to talk about a uniform policy which will, run across India, there could be few organizing principles that could be uniform, but states, the point I'm trying to make is states need to be much more proactive and much less Government of India driven. So they can't outsource their thinking to Government of India. And that is the point I'm making, that states need to build their capacities because the diversity is just so huge that sometimes the attention span of Delhi to manage this diversity becomes a constraint in itself.